Hi, I'm Dr. Randy Martin, and I'm pleased to be joined by Dr. Murahara. Dr. Murahara is professor of cardiology at the Nagoya University Graduate School of Medicine, and he's going to talk to us about an appropriately named study called the NAGOYA trial. Dr. Murahara, thank you for joining us. What is the NAGOYA trial?
Yes, as you know that hypertension and type 2 diabetes are two major risk factors, and if you combine hypertension and diabetes, increase remarkably the risk of cardiovascular disease. Now, as you know that either ACE inhibitors or ARBs are known to inhibit new onset of type 2 diabetes,
Right.
and also they inhibit diabetic renal complications.
Right.
Many hypertension treatment guidelines recommend ACE inhibitors or ARBs as a first-line medication for diabetic hypertensive patients. But in some studies, like IDNT trial, the irbesartan ARB has been shown to, and the calcium channel blocker amlodipine, almost equal effectiveness for major cardiovascular events. So it is still unknown that whether ARB or ACE inhibitors are really a first-line medication for diabetic hypertensive patients.
So is that what the NAGOYA study looked at, that question?
Yes, that's a basic question. So that's why we recruited only diabetic hypertensive patients.
Okay.
And we compared the efficacies between the ARB valsartan and CCB amlodipine in terms of major cardiovascular events.
How many subjects were entered?
We recruited totally 1,150 patients.
Big study, and and how long did you follow them?
Median follow-up time is 3.2 years.
So it's a sizable study, and that's very good. The next question would be, what were the findings?
Yes, actually, first of all, the control of blood pressure and control of blood glucose levels, as judged by hemoglobin A1C levels, was comparable between the group.
Okay.
And then primary composite cardiovascular events, there are no significant difference between the amlodipine and valsartan group. But if you look into each component of primary endpoints, the valsartan was superior to amlodipine in terms of inhibition of heart failure admission.
Okay. So do you think that this has an impact on the way we will practice in the future?
Yes, as I told you that many guidelines suggest ARB or ACE inhibitors as the first-line drug. And then our current results, together with the fact that ARB inhibit the new onset of type 2 diabetes, and also it inhibit diabetic renal complications, our results support current therapeutic guidelines for diabetic hypertensive patients.
Good. Well, Dr. Murahara, thank you for joining us.
Thank you very much.
Very interesting study. You did an excellent job of explaining it, and thanks to each of you for joining us.
Thank you very much.